Director of the Center for Women's Health and Wellness. If you are not here from UNCG, if you are a guest in the community, we welcome you in particular, and glad you're here. The center itself, in terms of just our vision, is to inspire girls and women to lead healthy, active lifestyles, promoting both mental and physical health. And we really saw this as a wonderful opportunity to really focus on our mission to promote mental health. And so we're just really excited to have Dr. Sonyia Richardson here. Already had a couple interactions with her today, and she's just, I think you're going to really enjoy this evening. So this afternoon. So just remember, after the lecture, we have a reception. We hope you will stick around and take some time to interact with her individually, as well as just enjoy the networking and time together. So with that, I will introduce Dr. Danielle Swick, who is going to introduce our speaker this afternoon.
Okay, hi all. It is my true honor to introduce Dr. Sonyia Richardson to you all today. I just have a snippet for you of all her amazing and wonderful accomplishments. Dr. Richardson is an assistant professor in the School of Social Work, director of the Race and Social Equity Research Academy, and the founder and director of the Mental Health Research and Practice Lab at the University of North Carolina at Charlotte. As a clinical behavioral researcher, her agenda focuses on developing and testing novel interventions aimed at reducing suicide among Black youth. Further, she aims to identify and remove barriers of mental health treatment for racially minoritized populations and eliminating resulting disparities through mixed methods research. As a respected scholar in the field of social work, she has published 2 co-edited books, produced numerous publications, and received over $1 million in grant funding. In addition to her work within academia, Dr. Richardson is engaged with local, state, and national initiatives. As a respected scholar in the field of social work, she was appointed to the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force by North Carolina Governor Roy Cooper in 2020. Additionally, she received the North Carolina National Association of Social Workers Award for the 2021 Social Worker of the Year, yay, social work, for her leadership and advocacy efforts. Locally, Dr. Richardson is the founder and owner of Another Level Counseling and Consultation in Charlotte, North Carolina. For over 15 years, the agency has been instrumental in providing counseling services, facilitating corporate and community wellness workshops, and providing consultation services internationally to corporations. These entrepreneurial skills support her ability to create successful collaborative research teams. Dr. Richardson is currently a Research Resiliency Training Fellow at Washington University in St. Louis and receives mentoring and didactic instruction concerning child and adolescent behavioral health. Recently, Dr. Richardson was selected by the National Institutes of Health in the 2022 Summer Institute on Randomized Behavioral Clinical Trials. Finally, Dr. Richardson earned a Doctor of Philosophy in Curriculum and Instruction from the University of North Carolina, Charlotte, a Master of Social Work from the University of North Carolina at Chapel Hill, and a Bachelor of Science in Psychology from the University of North Carolina, Charlotte. So, without further ado, please help me welcome Dr. Richardson.
Good afternoon, good afternoon. So as she was reading that, I was like, who is this person? Thank you all so much for coming out this afternoon. It is indeed a pleasure to be before you. I am so excited about the content I have to present to you this evening. I've been working on it for a while. And so without further ado, I'm going to get to that content, but I do want to give some just brief opening remarks. So I start out by quoting civil rights activist, women's rights activist, and abolitionist Sojourner Truth when she stated, "Ain't I a woman?" It is liberating to be in the space with each of you today as a Black woman, and to be honored for my womanhood as a researcher. This is what my ancestors always dreamed of, and so I appreciate the invitation. Special thanks to the teams at UNC Greensboro, including the Center for Women's Wellness, Health and Wellness, as well as the HHS Office of Research for inviting me and for hosting me. It has been a pleasure spending time with you the last day. Also, special thanks to Sandy Schultz. We have worked together for about a year planning this event. I've appreciated our conversations, the work we've done together, and it's truly an honor to be connected to you. Also, a shout out to my social workers in this room. Yay, yay, okay. And I know we have some visitors from Charlotte, so thank you all for coming. As well as a guest who flew in from Philadelphia. So thank you for being here. And everyone in this room is a special guest. There is not one special guest here. All of you are special. I do believe that this moment and this time together is ordained and planned and purposed. And so thank you for being in this space and for being a part of this purpose that's going to happen. All right, so my mom and sister are in town. My sister lives in town, and my mom came in town. She's not here today, but I was going to honor her if she came. She is out shopping. Shopping takes precedence over everything else. Y'all know how it is. But I do want to honor the two most influential women in my life, my mother and my sister. In their absence, they have been my rock, and they have taught me how to work my magic. And so I just want to honor them in this space as women. So my talk today is entitled, as you can see, Addressing Suicide Among Diverse Adolescent Girls with Community Engaged Intervention Development. So just so you know, I am a transformational teacher, and I'm also a disruptor. So I transform while I disrupt. So if y'all are ready to get started, and I'm from the South, and I was raised, if you know me and you've heard my story, I was raised in the church every day of the week almost. So if y'all all are ready to get started, can you just please say amen? Amen. All right, and I'm not churchy like that all throughout, but I do like to create community. So in her book, The Alchemy of Race and Rights, Patricia Williams, who's a legal scholar, states, I am interested in the way legal language flattens and confines in absolutes the complexity of meaning inherent in any given problem. So what exactly does she mean? Because that's a lot of jargon. She explains it further in the blue. So if we read the blue, it says, since subject positioning is everything in my analysis of the law, you deserve to know it's a bad morning. I am very depressed. It always takes a while to sort out what's wrong, but it usually starts with some perfectly irrational thought, such as, I hate being a lawyer. Patricia keeps it real in the blue, but the legal field restricts and flattens the realness of her experience. That's noticed in the green. What she realizes is the complexity of her identity is what has the most significant value. Her ability to embrace and fully show up in that identity adds richness to this world. It's not about conforming. It's about showing up uniquely as she is and bringing in all of her language and lived experiences into her work. I would argue that we don't need flattened language, flattened research, flattened teaching, flattened service, flattened mentorship. We need complexity of identity and realness. And when she combines the legal language on the left with the subject positioning on the right, so when we combine the green and the blue, it creates deeper meaning and it brings about realness of experience. So I want you to think about what space am I operating in my work, in the community, in my work in research or the academy. Am I restricting myself to the green, or am I allowing myself to show up in the blue? And then sometimes there is a combination of both of those spaces and bringing those in as well. So you all have a gift box in your chairs. You should each have one. My parents put together every single box. They assembled them. They're retired, and they love to put together these boxes for you. And so I do thank them for preparing our boxes. And I want you to hold that box in your hand if you can, if you're able to, or just look at it if you can. I want you to notice the box the size of the box, the color, the shape. And if you look around the room, you'll notice everyone has a similar box. The bow may be a little different as far as color, but everyone has the same similar box. There is no one else created precisely like you, and each of us are a gift to the world. Sometimes, though, we conform to look like other boxes, to sound similar, to show up similar, and have similar purposes. However, if you were to put your identity inside that box, your uniqueness would probably cause that box to explode because it's so rich. You were created uniquely and precisely the way you were, with your personality, your unique purpose, and your unique agitations. And that's according to Dr. Darius Daniels. He framed unique agitations, meaning you are assigned with something that uniquely agitates you and does not agitate anybody else probably around you. Those things that really bother you are your unique agitations. So you were created with those because you're supposed to solve those things. That's where your purpose lies. Have you allowed yourself to break out of your box fully? Whether you're a community member, a faculty member, staff member, student, administrator, father, sister, brother, spouse, or child, are you allowing all of who you are to show up in the spaces that you enter? As a researcher, you all have heard this on today, I was initially asked or advised to be careful of what I focus my research on. I was told if I researched Black populations, it would be difficult to get published, challenging to get tenure, and difficult to gain credibility. As a researcher who studies suicide, I was told that race and gender didn't matter in this field and that it would be challenging to get accepted in this space. I was also told by a suicidologist that I can't publish in certain journals because I'm not part of the Good Old Boys Network, because you got to be part of that network to get into the journal. But you know what? I knew my unique purpose, my unique agitation, and what mattered most to me. And this was helping younger Black populations to heal, to give them hope through research, practices, and relationships. But I had to bust outside of that box, focus on my unique purpose, and stay committed to it. So I suggest the same for every single one of you in this room. Speaking about suicide is not the most popular topic, although you will notice me smiling when I talk about it. That's a whole other issue. And it's not a feel-good topic, so it doesn't make you feel good. But it's my purpose, and it's what I was created to do. After busting outside of my box, I worked with a team to submit a highly competitive National Institutes of Mental Health R34 grant, and it was accepted upon its first submission with no revisions. This is a huge deal, an anomaly, but it was purpose. And one of my co-principal investigators is with me today, Dr. Vance. Yay! This is a huge deal, but it was purpose. I want you to consider your uniqueness, your ethnicity, your race, your gender, age, sexuality, ability, class, religion, and even body size, and how these have uniquely created who you are today, and I want you to fully embrace it. And just last week, I had an aha moment when I recognized that I had focused too much on my lived identity and realized that I needed to focus on my traits and abilities. So who am I and what's in my box? I am a Black woman, yes, but I am also kind, logical, bossy, Dr. Vance might co-sign that, organized, I'm deductive, friendly, I have a sense of humor, calming, prophetic, a dreamer, trusting, giving, stable, faithful, passionate, insecure, and competitive. That encompasses all of who I am. And with my lived experiences, these traits and qualities create something that is not in any other box in this world. There is nobody else in this world like me. So I asked myself, and I asked you, will you bring all of who you are into the spaces that you enter? I encourage you to keep this box in your bedroom, your office, at home, anywhere that you can see it. And I want you to daily look at it and say to yourself, am I truly showing up uniquely and authentically as I am? And am I allowing myself to bust outside of this box? And the day you decide to break it open and commit to living outside of your box, I want you to open it up, and there will be something life-saving for you inside. I feel like we can say amen. Along the same lines, when it comes to research or our work in the community, remember that we approach situations with an emic or an etic perspective. An emic perspective is when you have an insider's view. An etic perspective is when you have an outsider's view. Your identity and lived experience give you a nuanced understanding of particular identities, and this adds tremendous value to your research. As a Black woman with lived experience as a Black woman, I have a deeper understanding of the Black community, particularly from the perspective of a woman. I interpret and understand things more deeply, and this is not a deficit. This is an asset, a vital asset for the spaces that I enter. Whatever culture or background you are from, there are spaces where you present with an emic perspective and spaces where you present with an etic perspective. The key is getting people on your team with an emic perspective to give deeper insight. This is why the community and partnerships with the community are critical for helping to solve problems. The community has an insider's view. They know what it's like, what's working, what's not working. They know what's happening. And in academia, they need to be part of our team as they have this nuanced perspective. And also for people who are in the academy doing research, it's important for you to include people with emic perspectives on your research team as they increase the richness of your study and can add different perspectives. Every single person that you encounter has value and value to add to the work that you're doing. You just have to be able to recognize it. And so a plug at this time, I would say, is just to make sure as you're engaging in your work that you find people that have those insider views. People, and also connect with those who don't have the insider views, but you want to have diversity and richness in your teams so you can have different perspectives on the research. So this is a poem by Anthony T. Browder, who is an author, publisher, cultural historian, and it reflects what happens when we conform and stay in the box. This is what happens when we don't value or bring our emic perspective to the table. And in this poem, you can see the community shift from the emic to the etic perspective. When it comes to women and racialized women, it's important for us to stand in our emic perspective and not to lose our bearings on who we are. This is even harder in the field of research for which objectivity and conformity is the gold standard. So the gold standard in research is for us to conform and look alike and sound alike. But we have to be careful of that. Do not lose your emic perspective and knowledge. So the poem says, we knew not, we studied. We learned all there was to know. We taught others, then we forgot what we had learned, and then we forgot we had forgotten. Now we are taught by those whom were once taught by us, knowledge that we already had. So we study, we learn all there is to know, we teach others, will we forget again? That's the process of losing your identity. And that's what we want to be careful of. We want to make sure we maintain realness and trueness to who we are. So as you notice, so I have to do a feel-good before I get into suicide. And so that was my feel-good skill for you all. But as you notice by the title, we are speaking about suicide, which I understand may be triggering for some of you. So I invite you to take a moment of silence with me. Let's take a moment and reflect on those who did not see a better way out and died by suicide. We honor them at this moment. Let's take a moment and reflect on those in this world contemplating suicide. Let our presence today in this room give them the hope and strength to keep going and to reach out for help. And we send our energy to those people even now contemplating suicide. Let's take a moment and reflect on those in the future who will think about suicide. We ask for boldness in our ability to work with them to provide hope and inspire. Lastly, I want us to prepare our minds and bodies to deal with this topic today. So I'm going to engage you all in some deep breathing with me. We're going to practice 4-7-8 breathing. And this is before I get into suicide data, statistics, and all that stuff. So 4-7-8 breathing, you're going to breathe into 4, hold to 7, breathe out to 8. I'll say that again. You're going to breathe into the count of 4. I'm going to count for you. Breathe into the count of 4, hold for 7, breathe out to 8. And I will guide you in counting 3. All right, so let's start. You're going to breathe into 4. 1, 2, 3, 4. Hold for 7. 1, 2, 3, 4, 5, 6, 7. Breathe out slowly to 8. 1, 2, 3, 4, 5, 6, 7, 8. Let's do it again. Breathe into 4. 1, 2, 3, 4. Hold for 7. 2, 3, 4, 5, 6, 7. Breathe out to 8. 2, 3, 4, 5, 6, 7, 8. And one last time. Breathe into 4. 1, 2, 3, 4. Hold 7. 2, 3, 4, 5, 6, 7. Out to 8. 2, 3, 4, 5, 6, 7, 8. Okay. So hopefully your body feels a little bit more grounded, and so does your mind. So let's begin with some of this information. So let's start by discussing the need. So on this slide, you see the table to the left has the leading causes of death in youth ages 10 to 17, and that was in 1999. And then if you go to the table to the right, is the leading causes of death. I'm gonna do my mic. Okay, that's the leading causes of death among U.S. age youth ages 10 to 17. Here you have leading cause, second leading cause, and it goes on down. I'm going to ask for you all to participate in this part. All right, so when we look at 1999, and you'll see suicide is highlighted in red, and we go to 2018, tell me what you're noticing from the differences with suicide.
It's moved up to the leading cause.
Okay, it's moved up to a leading cause. And for which group would you say?
For Asian, Pacific Islander, and American Indian, Alaska Native.
Yes,
Non-Hispanic.
okay. So now we have suicides as a leading cause of death for these two groups. Thank you. What else do y'all notice?
It's also moved up for Black, non-Hispanic.
Okay, so it's moved up for Black and non-Hispanic, so they were further down. It's moved up. It's not leading cause, but it's moved up. What else do y'all notice? What do you notice with white? Oh,
Other than the white non-Hispanic, it has moved up for every group.
okay. So it's moved up for every group except for white non-Hispanic. Now it hasn't decreased, like it hasn't went down for white non-Hispanic, but it hasn't moved up. This is over approximately a 20-year period. And what's happened is the rates of suicide deaths have increased among racially minoritized populations. And this has been happening for a couple of decades. And it's moving towards the leading cause of death. And people are trying to understand what's happening. Now, luckily in the African American community, there was a congresswoman who took a charge to try to understand what happened. She convened a group of researchers and community leaders and politicians together, and they met with researchers and published the Ring the Alarm report. I believe that was in 2019. So they published a Ring the Alarm report to say Black youth suicide is a crisis. That report garnered national attention. And after that report was published, you then had national organizations coming out and having funding available specifically for Black youth suicide. But it took a political group coming together, magnifying and amplifying it as an issue for something to be done. Now, when we look at these groups for which it's the leading cause of death, we haven't seen that happen yet. That's where there's some additional work to do. Because until it's amplified at a national level, it will continue to stay there, and people will continue to overlook it because it's not amplified as an issue. So just the notion that policy sometimes drives our work, and it can help us to really move the work along. So because there was that national attention, Black youth suicide has received national attention and received funding. I have not seen the same, and maybe somebody else has, I have not seen that for Asian populations or for American Indian or Alaskan Native populations, okay? So definitely still more work to be done. At the same time, the gap between male and female youth suicide rates is narrowing in the United States. So we know that males in general tend to have higher rates of death by suicide. And you'll notice me saying, let me just say this. I say death by suicide because we don't say committed suicide, because committed suicide sounds like you committed murder. It was framed as if it was a sin. So we've taken away the language. They removed that insensitive language. We don't say committed suicide. We say died by suicide, because that's how you died. Okay? You didn't commit adultery or anything like that. You died by suicide. But that gap between male and female youth is narrowing. And so as that gap narrows, people are saying, okay, it's not just race that we gotta pay attention to. We gotta pay attention to gender as well, because that gap is narrowing, and our girls are having higher rates of suicide as well. So let's dig a little deeper. On this chart, or on this slide, you will notice there's one person to the left, there are 25 people to the right. Now, what we know with suicide is that for every one death, every time one person dies by suicide, there are at least 25 others who have attempted suicide. So we have in this country a large group of people walking around who have attempted suicide that there has potentially been very little intervention for unless they went to the hospital. Unless they had to receive emergency treatment or they told somebody, we might not even know. And they're walking the earth. And the thing about suicide is, you know, that those people most at risk for future death by suicide are those who attempted suicide already. So the people that attempted are your highest risk of future attempts. So we have 25 here and we have one there. Part of what researchers have stated, the reason why we haven't focused on these 25 in the past is because these 25 were mainly kids of color, they were mainly girls. This one here, because the rates were higher among white men, that male who died by suicide, or that individual dying by suicide, that is who has gotten the most attention in the research. So we have shifted the research to focus intentionally on the 25. So my research is about the 25, and I'm still trying to save lives, but I want to make sure we don't forget about the 25. Now, I had told the team yesterday I wasn't going to say this because my family was going to be here today, but I will share it today. I will share it with you all. But the question was, what drew me to suicide research? And what particularly drew me to this area of research is I am in a sibling group of 4. So I'm the youngest of 4 children. Yes, I'm the baby, I'm spoiled. But I'm the youngest of 4 children. And when I was a child, I witnessed 2 of my siblings attempt suicide. So I witnessed their suicide attempts. One of my siblings didn't have an injury, so didn't receive any type of medical treatment, mental health treatment. We just went to church, like I told the group yesterday. And the other sibling was hospitalized and did receive, they went to the ER, received medical treatment, and they were discharged. There was never any mental health care, follow-up, or anything like that. And I witnessed those things. And I've also had a very close friend who died by suicide about 8 years ago. She was a soror of mine. And we went to the same church, and she was always happy, and she died by suicide, unexpectedly. And so it's been those personal experiences, some of those experiences, that have propelled me to really figure out, okay, what can I do, and how can I help, and how can I save lives? So every day I do this work, I am intentionally focused on how can I save that next life? What can I do to help people to want to stay around? And part of the impetus for people dying by suicide is them thinking that life would be easier for everybody else around them and themselves if they were gone. So to think that things would be easier if I wasn't here, that's a heavy burden. And I want to help to relieve that burden. Also, I will tell you, in 2020, there were 45,000, a little over 45,000 Americans who died by suicide, but there were 1.2 million suicide attempts, okay? So just remember, 1.2 million in 1 year suicide attempts, and that's who's reporting suicide attempts. All right, so I'm gonna begin to bring an intersectional lens to this so you can understand it a little bit more deeply. Again, this is suicidal ideation and behavior, so let me explain what that means. Suicide ideation is you have a thought about suicide. So you're thinking about dying by suicide. suicide plan is you now have a plan for how you're going to do it. You may have thought through the time, the location, the means, where are you going to go, what are you going to do? You now have a plan. And then you have suicide attempts, where you actually attempt to die. And your intent is to die, but you have remained alive. The attempt is a failed attempt, okay? And so when we break this down from an intersectional lens and we look at ideation and behaviors, which includes thoughts about suicide, plans, and attempts, when we look at Black youth overall, this is national, based on Center for Disease Control data, 2019, you can see those rates for Black youth overall. And you'll see the decline as you get to attempts. That rate goes down, but 16% of Black youth who participated in the Youth Risk Behavior Survey, that's like roughly 1 out of 5, reported having thoughts of suicide. These are high school students. So 1 out of 5 Black high school students reported thoughts about dying by suicide. When we move over to the Black male category, we're at 10%. So now that goes down some. We're at 1 out of every 10 Black males thought about dying by suicide. But when we go to Black females, 23%, almost 1 in every 4 Black females has had a thought about dying by suicide at the high school level. These are babies. And then when we then bring the intersection of LGB, and if you notice, I don't have the other acronyms included because this survey does not include that data. It just includes lesbian, gay, and bisexual. 1 out of 3 have thought about suicide, okay? Which is not okay. And then when we move along planning, you will notice the decrease here. So it comes down some in Black males. Suicide attempts are 8 and 5. Black females, their attempts are 1 out of 5, 1 out of 6 roughly. So 1 out of 6 have actually attempted suicide. And then when we get to the Black LGB, this actually increases. So this is the only category where those who've actually had thoughts about suicide then move to a plan, which is pretty high risk. So it increases here. And then the attempts, 1 out of 3 Black LGB youth reported attempting suicide. And this survey for high school students is in the past year. This is not lifetime. This is in the past year I've had these thoughts. In the past year, 1 out of 3 attempted suicide. This is very, very alarming. One thing I do want to point out to you that I have stated to some people, when it comes to suicide, and you think about it from racially minoritized populations, for people who identify as white, their rates of suicide peak as they get older. So their rates are lower as they're younger, and then they peak when they get to older age. For all of the other populations of color, the rates peak at a younger age. So it's the younger people in racially minoritized groups who are dying by suicide at higher rates. And then those rates decline as they get older. So people are really alarmed about this because they say that it's a whole generation of kids that are dying that aren't even making it to adulthood, and that's affecting the population as a whole. And so that's why it's become such a critical issue, because these are kids dying. I will also say that I am so proud of myself. I am not smiling, but I see the intensity in your faces, and it's helping me because I usually smile when I talk suicide, I'm so passionate. But I appreciate y'all for being there with me. But the other thing I will say is that for suicide was one of the only public health issues or health issues where Black people had lower rates, or people of color had lower rates than white populations. If you look at diabetes, cancer, all of the other health diagnoses, most of them, within those diagnoses, people of color disproportionately tended to have higher rates. But suicide was the one area we were like, okay, we don't have those higher rates in our population. It's not happening to us. But for the first time ever, within the last couple of years, Black youth, ages 8 to 12, now have the highest rates of suicide of any population, of any population, any racialized population of the same age group. So it's the babies now, the 8 to 12-year-old babies that have the highest rates of suicide. And people can't figure out why are 8-year-old Black kids killing themselves? Why are these 12-year-olds killing themselves, what has happened and what has changed. And so I wanted to break this down so you could see the intersectional lens and why it's important to study race and gender and sexual minority status. All of those things present differently. So I'm going to show you some additional data. This is national suicide rates for girls. And this is girls only, and I disaggregated this based on race. So an interesting trend that we're also seeing, multiracial girls. So girls who are biracial or multiracial are having highest rates among most of the racialized girl groups. And so there's some research that is needing to be done in that area because that's very understudied. So we have 1 in 3% thought about death by suicide in the last year. 1 in 5 black girls, and you can see the rates kind of decrease as you move along here. Now you will notice with the white girls, their rates are higher here than some of the other racialized groups. That also is an indication that additional research is still needed on white girls to understand what is happening with this population as well. So I would say girls in general need us to do some of this work and need people to pay attention. So this is broken down for suicide ideation. Now we go to planning. 1 in 5 girls reported attempting suicide. So that is the collective overall number. Again, we have the multiracial girls with the highest rates of suicide, of planning. Let me just look at, I think I have a mistake here. Okay, so yes, it should not be attempting, it should be planning, so sorry about that, but the rates are right. So then as you progress down, those rates, you'll see, again, the Asian girls have the lowest rates, but they're still at 19%, so it's really not that much lower. But as you disaggregate this, you can see differences. And then this is the attempt data. So at a national level, 1 out of 10 girls has reported attempting suicide. And let me just state, these are self-reports. So these are the kids that are actually stating on the survey that they did it. So there's a population that's not reporting because they're not comfortable. So these are the kids that are actually reporting. And then again, our multiracial girls are a red flag as their rates are higher. So this is what we're seeing when it relates to our girls. If I was to mirror this, and I didn't want to center boys in our talk today, but if I was to center this with the boys, you would see lower rates for all of the racialized boy groups. So there is something going on with the girls as it relates to suicide ideation and behaviors. And again, that gap is closing for death by suicide. But because we weren't dying at those high rates of death by suicide, we didn't get the attention in the research. And so there's a plea now to pay attention, and the girls need us to wake up and pay attention to what's going on. There's some hurt, some harms that have perhaps been done, some oppression that they're feeling, and they need us to notice and get outside of our boxes and show up for them. And then lastly, this is really disturbing, but this is suicide ideation data for lesbian and bisexual girls. So I just aggregated this just on the lesbian and bisexual girls in the population. And you can see 47%, again, I'm sorry for the typo, I'm just realizing this now, but 47% reported not attempting suicide, but reported ideation. So having thoughts about dying by suicide. So that's 1 out of 5. 1 out of 2. So 50% of lesbian and bisexual girls reported suicide ideation, okay? And then as you go down the chart, you can see the race with the sexual minority status and gender. This rate here is lower for black girls, so now they're in the lowest represented category. Nonetheless, the data is disturbing, and this is what's happening. So as you notice, with the title of my talk, there has been minimal research regarding suicide among diverse adolescent girls, as well as community-engaged intervention development. And as I stated, federal funding has just been made available to study it by race. I have not seen the federal funding to study it by race and gender, or race and sexual minority status. So we're just at the very beginning brink of really trying to figure out what's happening. There is a window of opportunity that was framed by Powell and colleagues that focuses on creating research and interventions that can improve the client experience, improve clinical outcomes, and cut costs. So in each of the fields or areas of work that you work, there is a unique window of opportunity, an opportunity to actually do something, an opportunity to show up. And it's important for us to look out of our windows of opportunity to figure out where can I make a difference and where could I show up. I would argue that the interventions and the work that we complete must focus on holistic, intersecting identities. We can't do the one-size-fits-all approach, it's not working. And we must embrace the complexity of the meaning, or the emic approach, as I mentioned earlier. So my current work is focused on intervention development for Black populations, including intersectional perspectives and identities. So the window of opportunity, I am full-fledged walking through, committed to the work that I'm doing. And I ask you, what is outside of your window? Who is waiting on you to do something? Who is waiting for you to show up? What is that area of unique agitation that needs your intervention, that needs your ideas and your intellectual capital? And I ask you, will you take the step to discover new interventions, new possibilities, new partnerships, and new opportunities? And speaking of new partnerships, for community engaged work, I have some references to PCORI. PCORI is the Patient-Centered Outcomes Research Institute, which is a United States-based nonprofit institute that was created through the 2010 Patient Protection and Affordable Care Act. And if you have not looked at PCORI, they have lots of great community engaged research resources, and I'll show you one of them a little later. But when we think about community centeredness and community engagement, you're thinking about, does the project answer questions or outcomes that matter to the individuals within the context of personal preferences? Is what we're doing, does it matter to the community? If it does not matter to the community, your ability to do community engaged work is going to be really difficult and maybe obsolete. So it's got to be something that matters. But to know what matters, you got to talk to the community. You got to get out into the community. You got to find what their agitations are. And I have, for an example, Black youth suicide. So as Dr. Vance and I was talking to pastors in the Charlotte community, they were talking about how their congregants and community members were coming to them because their kids, even in college, were suicidal and they didn't know what to do. And they didn't know where to go. And they wanted to figure out a solution. That was something that mattered to the Black faith community in Charlotte. So you want something that matters. Your research questions and outcomes should reflect what is important to the community, and the research should involve the gatekeepers in the community. If you do not have the gatekeepers in the community involved in your research, it's going to be very hard for you to sustain that research. And gatekeepers meaning the people who have access to the people you want access to. So for us to get to the churches, we had to go through gatekeepers, and we have to maintain those relationships with the gatekeepers. And also just FYI, and our work, you'll hear about one of my projects in a second, but our work is focused on Black faith communities, and so some of those gatekeepers also include pastors. And so we have to build solid relationships with the pastors. Even Dr. Vance and I had to meet with the deacon board and deaconesses, and they drilled us on questions. We had to go through all of that in order to get their buy-in. With community engagement, community members are partners in research, not subjects. So we got to get out of seeing people as subjects and seeing them as a partner. And we have to ensure active and meaningful engagement in the community. So when I think more specifically about community engaged work strategies, it's important for us to do some research to understand what works with the specific communities we want to engage with. And so as we implemented this project with Black churches, we had to go to the research to see, okay, what have other people done to engage Black churches? And this is an article that is a little dated, but it has several preferences for the Black church community. So people have probably published in your area of interest, or if you're in the community, the community you're concerned about, they have published what works and what doesn't work and how to approach it. So for instance, we know to keep paperwork at a minimum. I don't show a lot of paperwork. When I go into meetings, I maintain my own digital copies of things. I don't do the paperwork thing. They don't like that. They want to make sure they receive adequate funding. They need us to be honest and give complete descriptions. So they want us to be very transparent and honest with them. They also want us to be sensitive to the church environment. And so that means Dr. Vance and I are having to push back against other researchers on our team and say, okay, we understand, but that's not going to work in this church environment, because we got to be sensitive to how it works in the church. We also have to disseminate results to the church. And then there is the idea or notion that the Black church is the symbolic heart of the Black community. And I've stated this earlier, but within the Black community, the Black church is one of the institutions that has sustained years of slavery. It's sustained everything that Black communities have been through, and it has been a source of wealth for the Black community. So it is a heartbeat of the Black community, and so understanding that is important as we engage in research there. This is also a chart from PCORI. I won't go over everything, but when it comes to engaging stakeholders in community engaged research, you're wanting them to engage in every part of this process. So, and then how are they involved is listed down here. And so you want them to be involved with thinking through research priorities, research questions, conducting the research, dissemination, and policy and practice. So you're engaging them within the whole process, and then how you're engaging them and what they recommend here is listed as well. And so some things to think about when it comes to community engaged research. So in summary, when it comes to community engaged intervention development, my view on this, and I put my S. Richardson at the bottom, it's not published, but it's kind of how I see things, how I see the world. A community engaged intervention approach requires the inclusion of emic perspectives in intervention development, so people with lived experiences developing interventions for people with those similar shared lived experiences, plus meaningful and sustainable community involvement of the community. So not come in and do the research and leave out, but come in and stay. And that then helps to lead to community engaged intervention development. So this slide, do not be overwhelmed. We're going to cover this tomorrow in our scholarly workshop. This is the orbit model. And we're going to walk through designing interventions for communities and how to move from discovery process to effectiveness. We're going to work through discovery and design of interventions. And we'll do some practice work around that. So it'll be very interactive, engaging, and fun. I'm not sure if people can still register for the workshop. Sandy, again, okay, Sandy says yes. So if you're interested, you can still register for the workshop. But I'm gonna walk you through this model and talk about how to take an idea and concept to the creation of an intervention and piloting that intervention and what that looks like and things you need to consider. So we'll walk through that tomorrow. So as I'm wrapping up, there are two studies, well, there's a couple, but I'm highlighting two for you right now. Two studies that I'm currently involved with. One with Dr. Vance is the CA Link, Culturally Adapted Linking Individuals Needing Care Study. This is a culturally adapted care coordination, suicide detection, and intervention model for Black youth. So as you can see, suicide detection, we're trying to detect suicide prior to suicide, death by suicide, and we're trying to intervene. This is a mixed methods test that we're engaged in, and we're pilot testing a novel intervention. The mixed methods approach is year one. We are conducting qualitative research to understand the needs of the community, presenting the link intervention to them, which is the intervention we have piloted and tested in Florida. We're then going to do a re-iterative process where we bring them back for a couple of rounds of focus groups. We take their feedback and we make modifications to the model, and we bring that modified model back to them and say, okay, what about this now? What do you like? What don't you like? What do we need to add? What do we need to take out? Should we have community health workers, or should we consider something else? So the community is helping us to develop the intervention. And then in the second phase of the research, we're conducting a randomized clinical trial where we will randomly assign people to a control group or to the intervention, and we will test the intervention and find out some of the outcomes that we're measuring there. That does involve a community-based participatory research model, and I have to hold on to the side of the stand right now as I say that, because we are doing this with a clinical trial, which is so difficult, particularly with a very focused Black community where everybody knows everybody. So y'all just keep us in your thoughts. But all for community engaged, and that's definitely Dr. Vance. Dr. Vance has more strengths in community engaged than I do. And then the Bridge to Better Mental Health study is with Village Heartbeat, Inc. This is a study that's funded by the North Carolina Department of Health and Human Services. And we're doing a pilot study there where we're testing a novel faith-based mental health intervention. And we have our initial health outcomes listed there. And we're aiming for 315 Black residents, adults, 18 to 89 in the Charlotte area, and the use of wellness hubs. So we're engaging in that project as well. So I leave you with this quote from Audre Lorde, womanist, professor, and civil rights activist. She states, "If I didn't define myself, I would be crunched into other people's fantasies for me and eaten alive." I challenge you to walk authentically in your purpose, to define what is in your box, and to put it to work. Show up in your emic perspective unapologetically, because this world needs you as you were created to solve the problem you were created to solve, and no one else was assigned to do it but specifically you. So do it and bust outside of your box. I have a resource here listed for you. This is Research Fundamentals for Community Partners. This is from the PCORI site that I told you about earlier. This is their web address, but if you go to the site, it actually has modules for the community on how to engage in research. So they train the community on what research is, what it looks like, what it means, and it breaks it down to community level words and understanding. So the community, if you're working with community engaged teams, you can ask them to get training from this PCORI website, which is free, and they can do the training and be more well versed on how to engage in research. And for those of you who are in the community who don't understand maybe research, and not to say all researchers understand it either, but for those of you in the community, this is a great website for you to go in and understand some of the terminology and words. So thank you all for your attention. It's been a pleasure, and I think we have maybe a few minutes for Q&A.